Hello, my name is Miranda Richards. Today I will explain how the four telehealth perspectives, provider, patient, policy, and technology/business work together to create sustainable, equitable, and efficient telehealth systems. Telehealth is more than virtual appointments. It is an entire healthcare delivery strategy that connects clinical practice, technology infrastructure, and patient needs. It influences how people receive care, how providers deliver services, and how policymakers regulate healthcare access. Throughout this presentation, I'll highlight how these perspectives interact, how change in one perspective influences others, why collaboration across sectors is critical, and what challenges telehealth still faces in real-world settings. My goal is to show how telehealth can continue evolving to expand access while improving quality of care, affordability, and long-term sustainability. The four telehealth perspectives: provider, patient, policy, and technology/business. Throughout this course, we studied each perspective individually, but real success happens only when these perspectives are integrated. Telehealth succeeds when clinical practice, patient needs, policy regulation, and technology/business strategies all support one another. From the provider's perspective, telehealth changes workflows, clinical communication, and decision-making processes. Providers must learn how new digital tools adapt physically exams into virtual formats and maintain quality care remotely. From the patient perspective, telehealth improves convenience, reduces travel and wait times, and increases access to specialists. Patients who live in rural areas or have mobility challenges especially benefit from virtual access. Policy determines whether telehealth is reimbursed, which services are covered, and who is allowed to provide virtual care. And finally, technology and business infrastructure determine the platform's security and financial sustainability needed to support ongoing virtual experiences. How these perspectives interconnect. An example chain reaction is that policy affects reimbursement, reimbursement affects provider adoption affects patient access, and patient outcomes influence future policy. These perspectives form a system. For example, reimbursement policies determine whether providers can afford to offer telehealth services. If reimbursement increases, adoption increases, access expands, and outcomes improve, eventually influencing future policies. When technology platforms improve, clinical accuracy improves and virtual communication becomes more effective. As providers gain confidence in these systems, they are more likely to use telehealth practices, and patients benefit from increased access. As patient outcomes improve, evidence builds that telehealth is effective and cost-efficient. Policymakers then consider expanding coverage, adjusting regulations, or supporting innovation programs. Each link affects the next, demonstrating this interconnected chain reaction within telehealth. Cross-sector collaboration, which is collaboration between healthcare delivery, technology startups, government agencies, and insurance and business stakeholders. Cross-sector collaboration is essential because no single sector controls telehealth. Providers need technology. Technology must meet policy requirements, and payment models must support sustainability. Collaboration creates shared responsibility for quality, access, and long-term success. For example, technology startups depend on policy rules and privacy regulations. Insurance organizations determine reimbursement models that affect provider adoption. Government agencies influence equity programs and licensing rules. Only when all sectors work together can telehealth expand successfully and remain financially sustainable. Real-world challenges. Some examples include broadband equity, digital literacy, provider training, reimbursement gaps, and legal/licensing barriers. Telehealth continues to face challenges such as broadband access, digital literacy, and reimbursement uncertainty. Understanding the system allows us to identify where solutions need to be applied and who needs to be involved. Patients without internet access or digital skills may or may not be able to fully participate in telehealth. Providers may struggle with learning new technologies or adapting clinical care to virtual methods. Reimbursement varies by state and insurance type, creating financial barriers. In addition, licensing rules can limit cross-state care. By identifying challenges within each perspective, we can also identify which sector should take the lead in creating a solution. Impact of change in one perspective. An example would be new reimbursement policy, which leads to more providers participating, which leads to more patient access, which ultimately leads to improved outcomes. Another example would be how technology improves goes to video quality increasing, which goes to clinical accuracy improves, which ultimately goes to better adoption. One change in policy, technology, or reimbursement triggers a ripple effect across the entire system. Telehealth is dynamic, and each sector influences the others. If reimbursement improves, more organizations offer telehealth appointments. When video quality improves, clinical decision-making improves. Each improvement strengthens another sector and leads to larger system-wide programs, showing just how interconnected these perspectives are. The future of telehealth. Key trends: AI and remote monitoring, value-based care, hybrid care models, and digital equity initiatives. Telehealth will continue moving toward hybrid care models, AI-supported clinical decisions, and remote monitoring. The future also emphasizes digital equity to make sure telehealth benefits understand populations. AI tools will help analyze symptoms, monitor chronic diseases, and support early detection. Hybrid care will combine in-person visits with virtual care and home monitoring. The healthcare system will increasingly focus on value-based care where quality and outcomes matter more than volume. Why telehealth matters. Telehealth improves access, quality, cost efficiency, convenience, and patient-centered care. Telehealth isn't just technology. It is a strategy to improve access, patient-centered care, affordability, and healthcare outcomes across the system. Telehealth reduces travel barriers, supports early intervention, and makes healthcare more convenient and more equitable. Key takeaways. Telehealth is a system. Policy, technology, business, and providers intersect. Collaboration is essential, and the future depends on sustainability and equity. In summary, telehealth operates as an interconnected system where progress requires alignment across policy, technology, business, sustainability, and clinical practice. Collaboration ensures that telehealth continues expanding in ways that promote equity and long-term sustainability. Thank you. Thank you all for listening to my presentation.